Today, we're going to be talking about a difficult topic in the veterans community. Post-traumatic stress disorder, also known as PTSD, has always been an issue for veterans returning from deployment. PTSD is a devastating combination of both physical and mental illnesses that are caused by a traumatic experience. Some symptoms associated with PTSD in veterans are depression, anxiety, and suicidal thoughts, as well as mental rehearsals of the experience. The physical symptoms can include avoiding various areas which could possibly trigger the event, as well as loud noises can also be a trigger. PTSD has on average affected 7% of the entire U.S. military. For veterans seeking help, there are a few options. To start, they do have to be diagnosed by a professional mental health professionalist who has specialized in diagnosing PTSD in the past. The screening for veterans requires 4 parts within the last month: at least 1 avoidance symptom, at least 1 reactive symptom, 2 cognition symptoms, and 2 mood symptoms. Another helpful diagnostic tool of PTSD is magnetic resonance imaging, MRI. However, this is a double-edged sword because although this can show highly detailed images of the patient's brain or physical injuries, the loud noises can cause some distress in the patient. Medical treatments include both psychotherapy and medications. Psychotherapy typically aims to talk to the patient, provide support, guidance, as well as education on what to do when their symptoms arise. The medications used are selective serotonin reuptake inhibitors, which act to help to alleviate some of the emotional symptoms associated with PTSD. However, some side effects of SSRIs are upset stomachs, headaches, as well as sexual dysfunction, but it is stated that these effects are moderate. On top of that, veterans seeking a more holistic approach can include lifestyle changes. Since some veterans do suffer brain injuries while being deployed, a systematic review showed that high levels of dietary glutamate found in animals and plant proteins and a recent traumatic brain injury has led to a higher probability of developing PTSD. Therefore, consuming glutamate in moderate amounts can help a veteran avoid developing PTSD. As well as exercise has been shown to lower anxiety and depression symptoms, sometimes even better than antidepressants. And here are the sources that I used for my project.